Hello, my name is Allison Landis, and I am going to be discussing my presentation topic, which is on coaching and disciplining staff. Topics that I will be covering with this presentation are what coaching exactly is. Another topic under that would be coaching different generations, disciplining, and guidelines for effective discipline. The first topic that I will be covering is coaching. Coaching is a collaborative relationship between a coach and a willing individual that supports continuing personal, professional, and career development through the acquisition of appropriate skills, actions, and abilities that are crucial to professional practice. Coaching is interactive and an interpersonal process, as well as time-limited and focused on achievement of goals. For coaching to be effective, the nurse must be ready, willing, and able. The topic of ready, the nurse needs to be psychologically able to accept coaching. Under willing, the nurse must be open to the process and interested in changing and motivated to improve. And able means the nurse must be capable of changing performance. I reviewed an article where a group of researchers subjected to a detailed analysis the advantages of using a broad network of coaching and its role in enriching the professional life of the members of the organization. In the survey, respondents were asked to rate the effectiveness of the system of coaching in the organization on a 10-point scale where 1 is very poor and 10 is excellent. The results that were found was the understanding of the effectiveness of coaching depends on an employee's satisfaction with the salary. This can be explained by the fact that financial income growth is often accompanied by career growth. This fact also plays a role in assessing the effectiveness of coaching since an employee has been working with a company for a long time and sees its advantages and disadvantages and is ready to transfer them to the younger generation. A 1% change of the salary satisfaction index will lead to a 0.89% increase of the effectiveness of coaching. The level of training, and the second result was the level of training and professionalism of a coach is most important factor in the effectiveness of the entire process of an organizational staff development. This fact was noted by 61% of the respondents who analyzed this quality as the most important for a coach. Another important factor in coaching is the difference in generations. Understanding employees' beliefs, attitudes, and values about the world and the workplace can assist a manager in more effective communication and coaching. The different generations that I'm going to cover are silents, which are those individuals who are over the age of 55. When coaching these individuals, they expect their manager to behave in a professional manner and expect their loyalty to be rewarded and their age to be seen as an asset, not a liability. We also have the baby boomer generation, which is ages 40 to 55. This generation performs best when a manager knows them personally and treats them as a peer. When coaching boomers, reminding them of their powerful impact they make every day on the lives of patients and their families can help reconnect boomers with their purpose and meaning of their work. This slide is focused on the Generation Xers, which is probably majority of this class. That is those who are younger than 39 years. Generation Xers often look for a casual and fun work environment. When coaching, build on their desire for skill development, best in an informal fashion. And Generation Xers are often receptive to coaching if the skill is associated with long-term success in their profession. The next topic that I'm going to discuss is discipline. Discipline calls the employee's attention to behavior that is not appropriate and must be corrected, and advises how to correct the behavior. The process of discipline is progressive and highly dictated by organizational policies and procedures. Discipline is not punishment, but it consequences of an employee's behavior. It is a warning. Discipline is not personal or designed to embarrass an employee. The next topic that I will be discussing will be on correcting conduct. 5 steps for disciplining staff. Working in management, disciplining employees is a necessary part of the job. According to nursemanagers.com, following these 5 steps can take trepidation out of the job. Step 1. Describe the unacceptable behavior. Be sure to be specific. Relate unacceptable behaviors to specific performance standards and ensure to focus on the behavior, not the individual. Step 2. Express the effect on the work unit. When an employee engages in unacceptable behavior, a work unit is typically affected negatively. And an example of this could be an employee always coming late to work. This can cause a negative effect on other staff members as well as patient care, forcing them to pick up an extra patient until the nurse comes, which will be delaying, maybe a certain med or a certain treatment for this patient. 5 steps continued. Step 3. Specify the required changes. Tell the employee the exact actions you want him or her to adopt. Tell the employee that his or her behavior must be in accordance with company policy. Step 4. Outline the consequences. No discipline is complete without a discussion of the consequences if the unacceptable behavior continues. And step 5, provide emotional support. Give your employee an emotional boost by expressing your support for his or her efforts. This should be sincere and heartfelt. You want them to improve. On this slide, I have inserted a YouTube clip that shows how a manager would effectively and appropriately follow the steps to address a behavior that is inappropriate. On this slide, I have included a YouTube clip that is an animation on coaching in the workplace. I want to thank you for watching this presentation, and I hope that you learned a little something about coaching and disciplining staff.